years passed, she put on some weight. And, you know, she noticed that the periods now became irregular. All right. So that's usually quite commonly the story, not in all cases, but that's what happens. And part of the reason for this is because the underlying issue is with a hormone we call insulin. The same insulin that we talk about in diabetes. In polycystic ovary syndrome, women have high insulin levels. And the insulin levels are high simply because the body is not responding well to the insulin. And so in order to control your blood sugar, remember, insulin is what the body uses to push down to keep your blood sugar under control. The body responds by producing more insulin. And it is these high levels of insulin that causes the problem. And why is it that we see it in women who put on weight or have a high body fat percentage, most commonly? Because fat cells are less responsive to insulin. So the more fat cells we gain, the less our body responds to insulin, and that drives up the insulin production. And now this excess insulin now begins to affect the ovaries. And that is what triggers the whole cascade of problems. So firstly, when it affects the ovaries switches and starts to produce more testosterone. Remember we said that male hormone, testosterone? Yes, produces more testosterone. And this testosterone is what is toxic to the eggs. So that's the reason why the eggs don't develop as they should. So now we're understanding it. We're breaking down the science, guys. I hope you're following me on this journey of knowledge and revelation of the science. All right. So now the testosterone levels are high. Not only does it stop the eggs, but it does something interesting. It begins to affect other parts of the body. One of the features of women who have polycystic ovaries is, for example, hair growth, what we call hirsutism. You know, beard growing, mustache growing, right? I have a nice picture here for you, right? So you get hair growth, all right, on the face, right? In what we call male pattern hair growth. So most women do not get hair growth along the face, the mustache, the chin area, right? But in polycystic ovary syndrome, this is a common feature, right? And this is because of higher than normal levels of testosterone, right? I hope we're seeing that. Is it showing up clearly? Yes. Now, the higher than normal levels of testosterone leads to hair growth, hirsutism. And the other thing that happens is that the skin gets very oily. So you can actually get like acne, right? You get acne. So the skin is oily, you get acne as well because of the increased oil production. I remember that the bumps are a result of blocked oil glands. The glands that produce oil, when they get blocked, you get these bumps. So whenever the testosterone levels are high, you get increased production of oil in the skin. So the skin is oily and you get acne. So now we understand now, guys, why it is that women now with polycystic ovary syndrome have these particular features. So we are saying so far the ovaries are polycystic. They may have hair growth in unusual, in male pattern places. They may also have acne, and the skin may be oily because of the high testosterone levels. All right. So now one of the other things that happens with polycystic ovary syndrome is that it begins to, and I'm going to speak to the gynecological issues quickly, and then I'll talk about some of the other issues. So from a gynecological standpoint, because the woman is not ovulating regularly, we said that her period becomes irregular, right? Remember we said that. We said also that the period may come light when it comes, or maybe heavy, but it's generally irregular. But because the ovaries are not releasing eggs in a timely fashion, sometimes women may present with fertility issues, difficulty getting pregnant. Right? So women with polycystic ovary syndrome may have difficulty conceiving. Well, notice I say may. It don't mean that polycystic ovary syndrome mean they can't get pregnant, but you may find that issue. And the reason why I'm saying it is, think about it. If a woman has a cycle every month for a year, that means she has 12 cycles. That's 12 times she releases an egg for the year. That means she has 12 chances for the year to get pregnant. Now, if she has polycystic ovary syndrome and she's only releasing an egg once every now and then, 1 in every 4 cycles, then it drops from 12 times to only about 3 chances. So you can see by nature of the base probability, just the mathematics alone, why women with polycystic ovary syndrome may have challenges in getting pregnant. That makes sense? That should be making sense to some folks. Now, somebody might was asking the question, what about the women who have not gained weight and are slim? Like I have patients, one particular patient of mine is very, very slim, and she has polycystic ovary syndrome. And for a while I was working up to find some other reason to explain her symptoms because, I was saying, boy, she's so tiny, her body fat percentage is so low. But remember now that the genetics also plays a role. And so for some women, the high levels of insulin and insulin resistance may occur at lower body fat percentages. And what's interesting is that you have also some women who have a high body fat percentage, very obese, but do not have polycystic ovary syndrome. And, what we have to understand is that each of our bodies are different. And this is why it's so important that when you're dealing with your health, you take an individualized approach. And also that your physician, your caregiver, also takes an individualized approach. This is very important because not everyone will fit into a box. This is what we call a cookie cutter approach to medicine. Does not work. There are certain persons who may not fit into that box. And so we have to be aware of that. And remember now we have genetics that plays a role in our health. And then we have the lifestyle that plays a role in our health. And so we have to be cognizant of those things. All right, so now we've gone through most of the gynecological issues. So we dealt with the fact that irregular periods, fertility issues, the ovaries that look bulky, large, and polycystic on ultrasound. And we have also dealt with the oily skin, hirsutism, and what those features are. We also need to understand that this condition, as I told you, is not just a gynecological problem. The underlying issue of insulin resistance also leads to other things. Guys, very, very important. Please understand this. Insulin resistance is the primary factor associated with a number of diseases, but most importantly and most commonly, diabetes, type 2 diabetes. So women who have polycystic ovary syndrome, it has been shown clearly by research that they are at increased risk of developing diabetes. In fact, if you have PCOS, you should be screened for diabetes, and you should be screened at least yearly. Okay? Now, why is this? Because they're resistant to insulin. So therefore, there's a chance that insulin, if you're not responding to insulin, you can end up with diabetes. It is also associated, this insulin resistance, with high cholesterol. High cholesterol. It also increases the risk of hypertension, high blood pressure, all right, especially when combined with obesity in women who are overweight or obese. All right. So you realize then that polycystic ovary syndrome, as I said at the beginning, is not just a gynecological disorder, but is a complex thing affecting all the systems of the body. Now, why is Dr. Campbell stressing this? Why am I stressing this point? I'm stressing this point because when I begin to talk about the management and the treatment, I want us to understand that your health, your approach to health is going to be critical to the quality of life that you have later in life. So what I tell my patients sometimes is that, Doc, why me? You know, why have to have PCOS and whatever? You know, why I have to have this bleeding problem and I have these challenges getting pregnant? And I said, and I will often say, this is actually a blessing in disguise. And invariably, when I say that, she stopped and she looked at me and said, Doc, what do you mean? Oh, blessing. Oh, this is a blessing. I don't see my period much more. I'm having these issues. Why is it a blessing? And so I proceed to explain that many of the people who end up with hypertension, diabetes, heart disease are patients who have the same underlying metabolic problems. And if you didn't present to me at this stage with abnormal bleeding and all of these gynecological concerns, you would present to the cardiologist, the diabetes specialist or endocrinologist, the internal medicine specialist, you know, whether it's hypertension, diabetes, heart disease, in the next 20 years. If you're that fortunate, sometimes it's shorter, 10 years, 5 years, 15 years. So by addressing polycystic ovary syndrome in young women, we can reduce the risk of heart disease, diabetes, cardiovascular, cerebrovascular disease, strokes, kidney failure, all of these complications later in life, even cancer, because evidence does show that high insulin levels is one of the risk factors for cancer later in life, because insulin is a growth hormone. And if you have one cancer cell that your immune system would normally knock that cancer cell out, if you have high insulin levels, now you're feeding the growth of these cancer cells. So guys, just, you know, why I'm so passionate about talking about these things, because I believe that we can help women and save lives, improve the quality of our women's life. I'll stick a pin right there. Make sure you guys are tuning in to my show. We're doing a show partner with Nationwide on Nationwide 90 FM every Monday, 8 to 9 o'clock, Beyond the Diagnosis. Right? It is the premier resource for women who need information. It's designed for women, designed specifically to help you. So if you miss it, that is because that is your problem, but you shouldn't miss it because it is designed for you. Every Monday at 8 p.m. on Nationwide 90 FM. Catch it on the radio, catch it on YouTube, streaming. All right. Back to PCOS now. So now that we understand the disorder, and remember to write down your questions because I'll be taking the questions at the end. We can talk a little bit now about how we solve the problem. Treatment. Now, when we talk about treatment, our approach is going to be dependent. There are some factors that are going to be dependent on where the woman is in her life and what her desires are. And there are other components that are true regardless of where you are in life. So let me explain. So for example, when we talk about whether or not pregnancy is desired at this time, that's a very important factor, right? So are you looking to get pregnant? If so, when? Is it now? Is it in 2 years? Is it 3 years time? You know, what is your plan? That's one of the key questions. Whether do you have other underlying issues? That's another issue. You know, are you already developing hypertension, diabetes, already have heart disease? That's another thing that we have to talk about. All right. So these points are going to be critical in determining how we approach treatment in patients with polycystic ovary syndrome. All right. So let's start first of all with the basics. The basics. So what is the goal of treatment? The first goal is really to reverse it. That's ideally the first goal, to cure the patient, to reverse their condition. All right, to bring things back to normal. That's ideally the goal. Now, we understand that that may not happen overnight. And so the secondary goals is to manage the potential symptoms and reduce the risk of potential complications. So manage symptoms and reduce the risk of potential complications. All right, so let's go over the three things. One is reversing it, and we can reverse it. While we're reversing it, we're going to manage symptoms and reduce the risk of complications. So remember, we said what the symptoms were. We spoke about, we were talking head to toe, we spoke about the acne, we spoke about the facial hair growth. We spoke about, sometimes some women even have male pattern balding too, because the testosterone levels are so high. And then we spoke now about irregular periods, whether you're not seeing it or it comes irregularly or it comes very heavy. And we spoke about the issues with ovulation and infertility. So those are some of the symptoms. Then the complications now, we talk about now, the most feared one is endometrial cancer. Because if the lining of the womb isn't shedding regularly as it should, and it's just growing, there is the possibility of that excessive growth. One of those cells that is multiplying rapidly can in an abnormal way and lead to cancer. So that's one of the most feared complications. Endometrial cancer, cancer of the lining of the womb. Very important. Now, what are other complications that can occur? We spoke about the hypertension, the diabetes, the other things, all right? So now that we understand those, let's see how we can approach managing a patient. So now when I'm finishing, all of you are experts now, all you need is a medical degree. You need a medical degree. I don't want any of you going out there to manage anybody so that you are managing PCOS because you come and see this little talk. I don't want anybody getting arrested. Please, guys. It is to help you. All right. So if you want to manage them, you're going to get a medical degree. But now you understand so you can advise your friends and family. All right. So let's get into treatment now. So firstly, we said that we want to reverse. And how do we reverse? Remember I told you, most of the time, the underlying problem is insulin resistance. And most of the time, the trigger for the insulin resistance is weight gain, most of the time. So therefore, adopting a lifestyle that is going to help women to help you to reduce body fat percentage is going to be critical to reversing. And in fact, the evidence shows that even 5 to 10% weight loss can reverse polycystic ovary syndrome in as much as 90% of patients, especially those who developed it as a consequence of weight gain. All right, that's how powerful it is. So now we're talking nutrition, exercise, right? Probably another time we can get into that in detail. So that's one. The next thing that we can do is we can use medication to help to improve sensitivity to insulin. So one of the drugs we use is metformin. There are other insulin sensitizers, but metformin is the most commonly used one. And metformin helps the body to be more sensitive to insulin, and in doing so, reduces the amount of insulin being produced. Remember I told you that is the excess insulin that is driving the ovaries to give trouble? All right. So we can use metformin for that. So that is how we try and reverse the features. Now, how do we treat the symptoms? And how do we reduce the risk of complications? So when we talk about the symptoms, first of all, irregular bleeding, absence of the period, quite often we may use hormonal medications. So for example, oral contraceptive pills, we commonly use those. And we use them cyclically so that they can begin to simulate the process that normally occurs, where the lining builds up and then sheds off. And by doing that, we help to control the bleeding. So it comes at a predictable time and it comes with a predictable flow. Now, not only does that help with controlling the periods, it also helps to reduce the risk of endometrial cancer later in life. Because now that the lining of the womb is shedding smoothly, there is less risk of that progressing to cancer. All right. So that's one of the benefits of that. So that helps with the bleeding issue. No, it doesn't do anything at all now for the ovulation. So for women who are looking to get pregnant, then this option may not be the best, at least not for a long term, because oral contraceptive pills are exactly that, contraceptive. And those medications prevent pregnancy. So we need to give something that's going to help those women to ovulate. And if they're able to reverse the condition with weight loss, fine, that does it naturally. Metformin may help as well. But in that subset of women, we may give ovulation-inducing agents. And there are two commonly used agents. You may hear of clomiphene or Clomid. That's Clomid is one of the brand names. And then you might hear of letrozole is a newer one. Letrozole is newer relative to clomiphene, but it is better for women with polycystic ovary syndrome. All right. So now that brings us to my talk. And the key things I want to leave with you is, one, remember that polycystic ovary syndrome is more than just a gynecological disorder. It has other metabolic effects, and I mentioned that it can increase the risk of diabetes, hypertension, hyperlipidemia, or high cholesterol, endometrial cancer, and in turn also can increase the risk of complications from those things, strokes, kidney failure, etc. Remember also that this condition is totally reversible in the majority of patients, and usually that involves weight loss or reduced body fat percentage. And I said majority because, as I mentioned, there is a smaller subset of patients for whom PCOS can arise even though their body fat percentage is quite low. And the third thing that I want you to remember is that the treatment options that are available are designed specifically to manage symptoms, improve quality of life until we can effectively reverse the condition. And that's it for me tonight in terms of talking. So I want to open up the floor now for any questions that you may have. Miss Moderator, okay, back to you.
Thank you so much, Doc. So I have one question. Someone is asking, if one has a dermoid cyst, can medication be used to get rid of it, or surgery is the only option?
So the question there is, if a woman has a dermoid cyst, can it be treated with medications? The answer to that is no. Most cysts that occur in the ovary are, cysts that tend to resolve on their own, may not even need any treatment. Dermoid cyst is a different, peculiar type of cyst. Because what it is essentially one of those eggs that would normally give rise to the baby begins to grow on its own, and it actually begins to produce fetal-like tissues. So it produces skin, hair follicles, those oil glands in the skin, all of those things, even sometimes teeth, pieces of bone, pieces of gland are produced within that cyst. And it's actually most times the oil that is producing that causes the cyst to form in the first place. Now, if you think about it, there's really no medication that's really going to get rid of those tissues safely and effectively. And so most of the time, surgery is the only way. Now, as to when surgery is done, it depends on a number of factors. What's the size of the cyst? What's the age of the patient? And what are the risks involved? And the main risks involved with a dermoid cyst, there are three main risks. One is that it can rupture. If it's very big, it can rupture, and that is not a good thing, because when that oily substance is released into the abdomen, it can cause a lot of inflammation, very difficult to treat. Two, if it's big enough, it can twist on itself, right? So if it, like a mango on a stalk, it can twist. And when that twists, we call it ovarian torsion, it can cut off the blood supply to the ovary, the blood flow from the ovary, and that can cause a problem where the woman can actually You end up in severe pain, become very sick, or could even lose your ovary. And very rarely, the third thing is a rare occurrence, which is where it can become cancerous. Very rare though. Less, like 0.002%, but it's still a possibility. So if, generally speaking, if you have a dermoid cyst that is greater than 5 centimeters, especially if you have had pain from it in the past, you should consider surgical treatment for that. All right. Let me see where the question is now.
Question. Good night, sir. Or good night, Doc.
Don't worry, I'm both sir and doc, whichever one is comfortable.
My question to you is, a female might not conceive during her teenage or in her 20s, but in her late 30s, 40s, going up to 50. Now, one will say, oh, you're in the high risk zone. That name, high risk, has been used like a name brand over the years. But I think some of us women does not know what high risk entails, whether if it's you're too old or what comes with the age for you getting pregnant. And if you get pregnant, oh, you're at an high risk age, be careful. What are the things that entails with high risk? For women who just know it as a name brand, high risk, but does not know what it entails.
I love this question, because as you say, it's a name brand, people just throw the words around. I remember I was laughing once I got a joke from a patient who was coming to the clinic, and the clinic is called the high risk clinic. But she was coming all the time and saying that she coming to Irish clinic, because we have these names that we throw around. But to answer your question, the first thing it's important for us to understand the point of obstetric care. Why is it that you need obstetricians and midwives and all these things? Women have been having babies for thousands of years. Why we need all of these people? The reason is simply that while most women will define in pregnancy, there are a subset of women who have issues, underlying conditions that could put them at risk of severe complications or even death. Okay? So once we can identify issues that may put the woman at high risk of complications or death, then she is considered to be high risk. Okay? And so let's look at some of the examples of these high risk conditions.
Right.
So you mentioned age as a high risk factor.
Yeah.
Now we pick on people and say, oh, you're over 35, and we put you as high risk.
Right.
But for a couple of reasons. One, the main thing is not really the age, to be honest. Women who are 35 and older are at higher risk of complications, hypertension, diabetes in pregnancy, what we call preeclampsia, stillbirth, bleeding. All of these things are at increased risk for. But the truth is, most of the time it's not because of the age. It is because our health tends to deteriorate as we get older.
Okay.
So by very fact that older women, we tend not to take as good care of ourselves, and as we get older, the body doesn't work as well if we're not taking care of it. Now, I can tell you that I've dealt with some 38-year-old, 39-year-old women who are in good physical shape, healthy women, and they are far easier to manage than a 25-year-old who is in poor health.
And why is it so? Why is it so?
It is really their health that is important, not just the age.
Okay.
So what I want, I'm saying that because I want women to understand that the best investment you can make in your child is taking care of yourself.
True.
Very important. So it's not just about, okay, you're over 35. No, you can't get pregnant or high risk. Fine, you can. But the key thing is being the best physical shape that you can be. Eat right, exercise, etc. That's one. The only risk factor that we cannot change with management of our health is the DNA. And you know, as we get older, the quality of our DNA, the eggs, quality and quantity of the eggs decrease. And so women who are older are at higher risk of certain genetic problems, we call chromosomal problems. That's where the genes are stored. So for example, we talk about Down syndrome is the most common one. They're at higher risk. So that's the only one that we can't really modify. But everything else that we consider high risk relating to age is something that we can modify if women are, you know, healthy or treated well on appropriate medications, etc.
Okay, understood. Thank you so much.
You're welcome, my dear. So I see a question here. There are a couple of questions. One was that I have one here that their 13-year-old who's on dying 35 for 2 years because of prolonged bleeding. What can be done? I think the most important thing in that case is to find out why that 13-year-old is bleeding. Most of the time, it is just because of immaturity of the hormonal axis, and she will grow it out. Sometimes using hormonal treatment may help if she's bleeding to the point where she's becoming anemic and so forth. But investigation is important because some of these young girls who are bleeding excessively may actually have underlying clotting problems, clotting disorders. And if we don't recognize it, they may end up with problems later in life. So that's important for them to investigate that. I don't want to take over my hosting from you, Mickey. So let's see how many we can get in before that.
Okay, Doc. So I'm seeing a question that says, since exercise and nutrition is basically the best way to reverse PCOS, suppose you are not disciplined enough to stick with an exercise program or change your diet, and you are afraid of being stuck on pills for the rest of your life, is there any other suggestion to help this person?
Yeah. Good question. Most of us may not be very disciplined, you know, to stick to nutrition and exercise and so. But the truth is, so a couple of things. We talk about for patients who have severe obesity, for example, bariatric surgery, which is where a surgery may be done to reduce the volume of the stomach. We talk about using medications that may reduce absorption of fat and help with weight loss. But one of the things I want to say, ladies and gentlemen, because they're gentlemen online, is that regardless, we are disciplined about something in our life. All of us are disciplined about something, even if it is eating poorly. You know, I'm disciplined about eating ice cream every Sunday. You know, there's a time when I was very disciplined about going to Burger King every Friday and buying a double Whopper with what they call it, not supersize, big Whopper or something like that. Big soda, big fries every Friday. Take me about 3 days to digest the burger, right? So the reality of it is that we're all disciplined. It's just a matter of what we choose to be disciplined about. Discipline is really speaking to what you're consistent at doing, the habits that you create. And so when it comes to exercise, it's no different. We find it easier to do those things because that's what we were trained to do from we were children. If you think about what our kids eat, how many people giving their children carrots and hummus and chop up making salads for their snack? No, we give them cheese tricks, bag juice, cheese puffs, sweetie. So from we were kids, we have been hooked on a high carbohydrate diet. And so it's hard for us to change that. So it really is going to involve us gradually beginning to make a concerted effort in changing those things. And the first thing you have to is look in your house, what you have in there, and begin to say, listen, I'm going to put in my house the things that I want to put in my body. You see, because I tell my wife, for example, please don't buy any ice cream, don't buy any soda, don't buy any chips, don't buy those things, because if it's in the house, I'm going to eat it. But if I go in the fridge and all that is in there, is some pak chai and some, some lettuce and some spinach and all these things, I might end up eating a salad instead of eating one of those things. So the point I'm trying to make is that you're going to have to, if you're going to be disciplined about something, and if we're not disciplined about how we eat and how we take care of our bodies, we're going to have to be disciplined about the medications that doctors are going to put you on later in life. So it's just a matter of choice.
All right, the next question is, what about the use of unipearls to treat PCOS?
Unipearls to treat PCOS. Oh my goodness. Listen, ladies, please avoid these pearls. Right, so some people might not know. Right, let's make sure I'm understanding. So unipearls are some herbal, essentially pessaries, little herbal bags that they insert into women insert into the vagina that is supposedly to provide a cleansing effect. I know they've been marketed for treating vaginal infections and maintaining freshness in the vagina, but I guess people are marketing now for PCOS too. We have to be careful because, you know, that nowadays, and I've become so concerned about what I'm seeing in medicine. Medicine has become a confidence show. A lot of people are trying to make money off people's vulnerabilities. So unipearls are things that you shouldn't be putting any foreign body in your butt, in your vagina, you know, because all that does is that it attracts bacteria to grow on it, can put you at risk of serious infections, and it really is not going to do much for your PCOS at all, if any. And certainly we don't want to make matters worse in the long term for your vaginal health.
Okay, someone is asking if inositol is good for PCOS.
Yeah, thanks to that person that asked me that question, because I forgot to bring it up in the presentation. While inositol is not established as mainstream, there is a lot of evidence indicating that my inositol is actually quite beneficial and equivalent to, at least equivalent to metformin in treating polycystic ovary syndrome with less side effects. And, you know, that is available over the counter in different preparations. So, yeah, yes, that's something that, you know, many women are using. As far as I've seen, it seems to be a good product.
Another person is asking, what if the female has period every month and has PCOS and has one tube due to ectopic pregnancy?
Say that again for me.
What if the female has period every month and has PCOS and has one tube due to ectopic pregnancy?
Okay. You know, there are some women who have polycystic ovary syndrome who can have regular periods. It may be, as the condition improves, that the periods become regularized. So that's another factor as well, because remember, we said that it is something that can be reversible, right? Now, I'm assuming that the reference to the ectopic and the tube is because of their fertility concerns. When we talk about getting pregnant, remember now, releasing eggs is only one thing. You need 5 things to get pregnant. 1, you need to be releasing eggs. 2, you need tubes that are open for the eggs to move to the uterus. 3, you need the uterine lining to be healthy. 4, you need the cervix or the neck of the womb to open for sperm to enter. And 5, you need a source of healthy sperm. And so if there's difficulty getting pregnant, any one of those or multiple of those factors could be involved. So for example, if there's a history of ectopic, one tube is removed, it's possible that the other tube is also damaged. And so therefore investigation of that tube would be important if pregnancy is the plan.
Another question, how important is it to have a good support system when dealing with PCOS? Yeah,
I love that one too. You know, support is important for everything, every aspect of any medical condition you can think of. Simply because of the fact that let's look at, for example, a woman who's having irregular bleeding. If she's having irregular bleeding, she doesn't know when her period is going to come. So she could be walking around one day jolly and all of a sudden the bleeding starts and it messes up her clothes. That's embarrassing. She's not prepared. Or the bleeding may come and may be heavy. Now she's at risk of becoming anemic and very sick, very weak. She can't function. Sometimes she might not be able to go to work, affects her ability to concentrate at school, all of these things. Then you have the patient who may be trying to get pregnant for years with PCOS, can't get pregnant. So now every Mother's Day, she upset, she sad. Every Father's Day, there's a problem. You know, family is saying, "What it says when you have a baby, look how long you now give me a little grand," you know. So now that is also creating anxiety and stress. And then you have, you know, the patient, for example, who has acne, who has hair growth on the face. These cosmetic issues can affect women's self-esteem. So you realize that this is a condition that can seriously damage a woman's, not just their physical function, but psychological state. And so having people around who understand and support is important. And that's why I want to commend you guys for us having this kind of talk, so people can understand what women are going through and be more, you know, be more sensitive in terms of how we deal with and we support our women. All right.
All right, someone asks, what if the female sees her period every month, even though she has PCOS, but still can't get pregnant?
Yeah, so I think what the answer to that question would be she needs investigation, because PCOS is not the only cause of subfertility or infertility. As I mentioned before, it could be something with the tubes, it may not even be her. It could be that her partner has a low sperm count. It could be that there's an issue with the function of the sperm. So investigation is going to be key there.
Someone is asking, if the tube is damaged, can it be repaired for pregnancy?
So the question is, if the tube is damaged, can it be repaired? It depends on the severity of the damage and the location. So that would require some investigation to determine that. In some cases, the tube can be repaired. It rarely does return to its original function, though, because most of the time there is some scarring there. And so therefore the chance of success is less after tubal repair than with normal tubes. But yes, depending on where the damage is, sometimes the tubes can be repaired.
All right, before I take Chrisan, someone wants to know where we can find your office.
All right. I'm overseas at the moment, but I do have offices in Jamaica. One, Skyline Medical, is in Duhaney Park, right across from the Duhaney Park Police Station. And the other is at 4 Hillcrest, at ACE, at Healing Gynecology, 4 Hillcrest Avenue. That's off Hope Road. Even though I'm overseas right now, we have excellent gynecologists. My sister is there. We have a number of different gynecologists at both locations, and they're amazing. So if you need help, they'll be happy to help you. I'm going to put I'll probably give you the number, Mikhail, for you to circulate, but it's Healing Gynecology. In fact, if you look it up on Google, you're going to see Healing Women's Clinic, right? That's going to be the name on Google. And if you look up Skyline Medical on Google, both of them are listed there. You'll get the directions and everything that you need. And you can also message them through Google.
Okay, thank you, Doc. I thought I saw a hand.
Yeah, so
Chris.
Mine.
Okay, you can go ahead.
Good evening, everybody. My question is, so I have a friend, right? She has PCOS and was placed on birth control for 2 months, and it fixed the problem for 2 weeks, and then it went straight back to how it was before. So at first she wasn't seeing her period for like 4 months at a time, 4 months, that type of thing. But then after the birth control, it was like 6 months and more. And also she developed high blood pressure also. So my question is, do you think exercise and change of diet would be best for this person to, get rid of the PCOS, or do you have another suggestion?
Yeah, thank you very much for that, Chris. And you know, the lifestyle part of it, exercise, nutrition, is required for everybody. I would say every woman with polycystic ovary, I mean, everybody, yes, but especially for polycystic ovary syndrome, the first and most important intervention that should be discussed with the patient is the lifestyle change. In fact, this is where you may, that person may even need the help of a professional, a nutritionist, for example. And depending on what she's dealing with, the approach to how she's going to change her diet may vary. Some person may benefit from a combination of intermittent fasting with calorie restriction. Some people may benefit from, depending on what's happening with them, cutting down, you know, for having more frequent meals with a meal plan. Some persons, because of their weight, they can't get up and start running a marathon. I mean, you know, 200 pounds, 250 pounds, you start doing that, you're going to mess up your knees and your hips. So you may be just walking daily, start out with something basic, doing some swimming, some exercise in the water. Those are the things that are going to be key. And so I agree with you totally that that's going to be an important part of her management. The other things are just to manage the symptoms until you know, she can get sorted, you know.
Thank you, Chrisan. If anyone else has a question, you can put it in the chat or raise your hand using the icon.
All right, I see another question here that I have diagnosed with PCOS, but I have had no weight gain or hair growth. Can PCOS be reversed? Yeah, I think I mentioned that, yeah, that some women with polycystic ovary syndrome may not fit the classic profile, you know, in terms of, you know, being obese and so forth. Or sometimes we have to consider that maybe there's another diagnosis apart from the PCOS that you may have. And yes, it can be reversed.
A question in the chat: I took clomiphene 5 times after my ectopic pregnancy and it did not work. What could be the cause of it?
Yeah, so the answer to that question is, what does not work mean? Because, you know, most of the time when a woman says it does not work, she's speaking of she did not get pregnant. The purpose of clomiphene or letrozole, as I mentioned, is to induce ovulation, is to get the ovaries to release the egg. So what should be happening when a woman is started on clomiphene is that this needs to be clear, that the objective is to get you to ovulate, and you should have a test of ovulation done. That is the only way you will know whether or not the clomiphene, quote unquote, worked. So if you start on clomiphene and you do an ovulation test, and it can be done either with a blood test or with urine test ovulation kits, probably a blood test. Once we have confirmed that there is ovulation, then it means that the clomiphene has done what it's supposed to do. If you are still not getting pregnant, then it may suggest that there may be another underlying cause. And that is why the investigation part of it would be important. Hopefully that helps.
All right. How do you treat PCOS when there is no sign of hormonal imbalance or no abnormal increase in testosterone levels?
Yeah, so once again, the first thing we have to determine is this PCOS? You know, because the many times we throw around the term, but is it really PCOS? So generally speaking, the diagnosis is based on the presence of 2 or more of these 3 factors. One is that there is what we call anovulation or oligoovulation, which means that the person is not ovulating regularly. So that is 1. 2, there is evidence of increased testosterone, and that can either be demonstrated by a blood test showing increased testosterone or features of increased testosterone, such as hair growth, oily skin, acne. All right. And the third thing is the presence of big or polycystic ovaries and ultrasound. So in order to be diagnosed PCOS, you need 2 or more of those 3 things. So if the person has no evidence of increased testosterone, has no evidence of anovulation, which usually manifests by irregular periods or missed periods, or they have no evidence of polycystic ovarian ultrasound, they are not polycystic by definition. What quite often happens is that a woman does an ultrasound, and the ultrasonographer or the radiologist says that the ovaries look polycystic. They come back to their doctor with an ultrasound, and the doctor says, oh, you have polycystic ovary syndrome. It is important to clarify that there's a difference between polycystic ovary syndrome and having a polycystic ovary. You can be a normal female and have a polycystic appearing ovary on ultrasound. Or it may simply mean that the process is starting, but it has not manifested all its features yet. So that's very important for you to understand. All right. All right, so we have a hand raised there. Jean has raised her hand.
Yes, good evening, everyone. Does PCOS affect one's mood? Causes one to have mood swing?
That's a good question. It is possible. It is not established as one of the features of, the main features of PCOS, but it is possible. Now, there are many reasons why women could have mood swings, especially in the context of PCOS, because remember, as we mentioned before, the manifestations, be it the abnormal bleeding, be it the cosmetic issues, be it the issues with weight gain, be it the issues with fertility, all of these factors can weigh in on a woman's emotional state and therefore can manifest itself with emotional lability or mood, what you call mood swings. So that is also important to consider as well, separate and apart from the hormonal effects of the condition.
Thanks.
You got that, Jean?
Yes, Doc. Thanks.
Okay, you're welcome.
There.
So another question here about berberine. I'm assuming I mean berberine, which is it a good supplement for PCOS? So berberine is a supplement that's becoming increasingly popular now. It's like a kind of bitterish root thing that has been shown to be beneficial primarily as it relates to insulin resistance. It improves insulin sensitivity. And so naturally, it can be postulated then that if insulin resistance is part of the issue with PCOS, then it may help. But I'm not sure that we have large studies yet confirming exactly how beneficial it is, but I imagine it could help and should perhaps be more benefit with very minimal harm if not, taken excessively.
Okay, we'll take one last question and then we'll wrap it up.
All right, one last question, guys. You guys getting this for free, and people pay good money for this. All right. Okay, you see, if we're not having...
Hey, Doc. It's Megan. You have persons who say after having a baby, there's this sudden increase of being overweight. Why is it so? And that it's mostly around your abdomen. And people do talk about you wearing this belly band. I know this young miss who after pregnancy, she said to me, Mrs. Facey, my mother let me wear one belly band. You should wear one too. And I'm like, what is this belly band? And she said her mother asked someone to buy the toughest piece of jeans material and asked a tailor to make this belly band. I asked her, how long was this thing? And she said, you have to wear it from underneath your breast to just the top of your vagina, and you have to embrace it tight. And I'm like, I don't know about this. So can you explain to me what is it for and why this increase of fat that they call baby fat?
All right, Marie, I love your question. I love your description. I mean, you describe it so well. I can picture the jeans being wrapped around the lady. All right, so first of all, I'm going to give a plug. Marie, you should be watching the show every Monday at 8 o'clock, because, we discussed this a couple of shows ago. We're going to discuss it again on Monday. I'm going to make sure that we talk more about this on Monday, just for you.
Okay, sir. I remember.
I know my co-host is online. Kim, I'm sure Kim is hearing this, because we're going to be talking about, these kind of situations after pregnancy. So I'm going to answer your question specifically. It relates to the weight gain. And I'm going to encourage you to join the show on Monday for us to talk about the belly band, right? If you're listening on Monday, nationwide 9 FM for the belly band part. All right, so the weight gain. All right, there are a couple reasons. One is biological, two psychological, and in fact, I'd probably say three, because there's also the socio-economic part of it. So let's look at the biological part. So biologically, when you get pregnant, first of all, for 9 months, you're carrying around the equivalent of a big school bag full of books, right? And, after you graduate from school, right? Now you realize that certain things remain the same. You take off the school bag, but you empty out some of the books, but you still have some. So you're still carrying some weight. Now you realize that during pregnancy, a woman's activity level falls, right? Because she just can't do as much as she would normally do. She feels tired, she carrying this weight around. Her muscles become become somewhat weak, or her ligaments become more lax, and she becomes more prone to injury. So after she delivers, unless she has an active plan in place to resume the level of physical activity that she had achieved before pregnancy, she's going to become more sedentary than she was before. In other words, she's going to do less in terms of physical activity, right? So that's the natural part of it, because she spent 9 months changing her approach to physical activity. So that's the biological part of it. Also, now, from a psychological component, now women now tend to become less focused on themselves. Once that baby born, all the attention is on baby, taking care of baby, watching baby, right? The baby can walk till him reach about 1 to 2, right? So all this time, the baby is sedentary, and you're caring for the baby that is not moving. So guess what happened to you? You're not moving either, right? So once again, physical activity is reduced. Then you add to it the social interaction part of it. And this, I think, is a major problem, because what we give kids to eat is different from the ideal food that we should eat. So we talk about the cheese tricks, we talk about the juices, we talk about the snacks, as Jamaicans call it snacks, right? We talk about these things. And what happens is that, can you imagine when you're 5 years old eating cheese tricks is a different thing from when you're 35 or 45 eating cheese tricks. So we buy the food that kids eat and we stockpile the food in the house for kids. But guess what happens? We end up eating like kids. And so all of those factors now begin to play in on the fact that into the weight gain dynamic. And remember now, you're coming out of pregnancy carrying some of that fat anyway, so that you didn't lose. All right. So unless women are breastfeeding, and breastfeeding is one of the ways that the good Lord made for women to lose weight after pregnancy. So when you add all of that together, you can understand why women gain weight after they have babies. Does that make sense?
Yes, it does. Yes. pretty clear. Thank you.
You're welcome, my dear.
Thank you for all those who participated, and thank you so much, Dr. Campbell. So on behalf of our host pastor, Rayon Daly, and the Palm District of Churches, we say special thank you for being such an amazing audience. We also want to express gratitude to Dr. Campbell once again for such an insightful presentation. I'm sure we all learned something this evening, as it was truly informative and engaging. At this time, we'll have a special prayer by Sister Thelma Henry as we close.
Before you close, Michael, we're doing this again next week, right?
Yes, Doc.
Yeah, because I was, I heard that we're doing it again next week. So we should put a plug in there for those who are listening.
Yes, I plan to tell them about next week,
Okay, just making sure.
Sister Henry?
Okay, let us pray. Great God and our Father, praise be to your high and holy name. Father, we just want to thank you for allowing this online gathering. Thank you for this very informative presentation by Dr. Campbell. Thank you, Lord, that as women and men, we have a platform where we can access accurate information concerning our health. I ask that you remove all fears, remove all doubts and sadness, and refresh our souls so that anyone suffering from this condition will be enlightened and strengthened. That with much effort and stick-to-itiveness to the medical plan, their condition can be controlled and even cured. Dear Father, I pray for understanding, patience, and kindness from their partners and family members as they become more aware of the challenges these women face. But Lord, we recognize that you are the great physician. You are the doctor of all doctors. And I know that there is nothing too hard for you. So please let your healing touch cover and permeate the bodies of these women affected by this condition. And may all praise and honor go to you only. I pray that you will bless Dr. Campbell and his family and give him health and strength, dear Father, to continue this great work of helping to restore women's health. Lord, I thank you for hearing. I thank you for answering as I leave every request with you to do according to your will. In Jesus' holy and precious name, amen.
Thank you, Sister Henry. So Dr. Campbell would have hinted that we'll be having another session next week. So please join us again on Thursday, March 30th, same time via the same medium with the same presenter, Dr. C, where we'll talk health in the virtual world. Tell a friend about the program and let's share in the blessings together. I am Micaiah Morgan, your moderator, saying thank you for sharing this evening with us. Good night and God bless you.